My name is Sarah Haag, and I'm a doctor of physical therapy and the author of Understanding and Treating Incontinence. As a clinician, I get asked all the time when people come into the clinic some questions about why incontinence is happening and what's going on. So the number one question I get is, did I do something in particular that made this happen? The short answer is no. The fact is there's a lot of things, different risk factors that can contribute to the development of urinary incontinence. And this is why one of the most important things is that if you're experiencing incontinence and it's a problem you'd like to address, is that you do discuss it with a pelvic floor therapist and figure out the reasons why this is happening to you. Another question that people will ask me is there something seriously wrong? Like, is there, they will ask me about cancer, they will ask me about neurological diseases. And to be perfectly frank, incontinence is very, very, very common, and all of those other things are very, very rare comparatively. So most of the time when incontinence is present, it is not because of some kind of scary or bad thing happening anywhere in the body. It's mostly just there's been enough factors that make that closure pressure not strong enough to deal with whatever's happening in our intra-abdominal pressure, or a bladder that's starting to misbehave. Many of these things can be addressed with physical therapy. However, if you are concerned about more serious issues, please consult your physician and rule those things out, and then get started on pelvic floor PT so that you can get better. Another really common question I get is just, will this get worse as I continue to age? Again, the short answer is no, not necessarily. The truth of the matter is, as we age, our muscles change. It takes a little more work to keep them as strong as they once were. Our bladder changes a little bit, our kidneys change a little bit. However, by taking care of your pelvic floor and taking care of the rest of your body, there's no reason that not only this won't get worse, but that it could actually get better as you age and address those issues. And then finally, people really do want to know, can this get better? Many people, by the time they find me, have suffered for many years with urinary incontinence because they didn't know that there was help or that anything would actually work. So the great news is we have excellent evidence that pelvic floor exercises can help manage or even cure urinary incontinence. And then there's also several other options from bladder training, looking at your diet, as well as surgeries and medications that could make these problems be a thing of the past.